Hello viewer, welcome back to my YouTube channel. Please subscribe my channel and also click the bell icon for further notifications. And now I am going to discuss about bone marrow transplant. And I will discuss about introduction, how serious it is, survival rate after a bone marrow transplant, major surgery. So I will start with the introduction. Hematopoietic stem cells transplantation is the transplantation of multipotent hematopoietic stem cells, usually derived from bone marrow, peripheral blood, or umbilical cord blood in order to replicate inside of patient and to produce additional normal blood cells. It may be autologous, allogenic, or synergenic. Now we will discuss about how serious it is. A bone marrow transplant can pose numerous risks. Some people experience minimal problems with a bone marrow transplant, while others can have serious complications that require treatment or hospitalization. Sometimes complications are life-threatening. Survival rate after a bone marrow transplant. How long can you live after a bone marrow transplant? Understandably, transplants for patients with non-malignant diseases have a much better success rate with 70% to 90% survival, with a matched sibling donor and 36% to 65% with unrelated donors. It is a major surgery. A bone marrow transplant does not involve major surgery. Rather, it is performed similarly to a blood transfusion. In a bone marrow transplant, bone marrow cells are collected from a donor's bloodstream through a needle inserted into a bone, typically a pelvic bone. What happens after that? A bone marrow transplant takes a donor's healthy blood forming cells and puts them into the patient's bloodstream, where they begin to grow and make healthy red blood cells, white blood cells, and platelets. Patients receive high doses of chemotherapy to prepare their body for the transplant. Thank you viewers. Please subscribe my channel.